Welcome to Welfare Clinic. Our heroes. How did the NHS doctors, nurses, and staff manage during the first pandemic of coronavirus and first wave, and how are they managing now? It was the clapping for them enough? Did that satisfy them? Was what else we can do to support our heroes? The difficulties they face and their family face. These are some of the issues we're going to be discussing, along with how is the coronavirus affecting this time round? How is the community being affected? And what kind of advice that we can get from our doctors and nurses and staff joining us today. You are welcome to join us via our VodTalk social media, our YouTube channel, Facebook page. And if you have any comments, any questions you want to ask my guest, then please do feel free to do so. I'm going to introduce my guest. My first guest is Dr. Kambiz Boomla, academic GP at Queen Mary University. But Kambiz have been GP since 1982 in Tower Hamlets. I've known him for a very long time. Kambiz, welcome to the show.
Thank you.
My next guest is Boshura Khatun, who's a respiratory nurse working in a London-based hospital. Boshura, welcome to the show.
Hello, thank you for having me.
No problem. My next guest is Tazmina Ahasan, discharge coordinator working in Queen's Hospital. Tanzania, welcome to the show.
Thank you for having me. Thank you.
Thank you so much for joining me this evening. I really appreciate your time. And just before we go to Kambiz, I just want to remind our viewers once again, if you have any questions, any comments to our three of my guests, then please do feel free to send them via our social media pages on Facebook, VodTalk, or YouTube channel. Kambiz, if I can come to you first of all, we are currently in a national lockdown. Obviously, we was in tier 2 restriction, then it was moved to national lockdown when scientists was calling since September. Many opposition political leaders was calling, but the government was very reluctant. But eventually, Prime Minister did have to go into national lockdown. Do you think it's working?
Okay, so yes, a lockdown is working, but as usual, all these measures have been too little and too late. So if we go right back to the beginning of the coronavirus pandemic, far fewer people would have died if the lockdown had started 2 weeks earlier. And at the moment, again, we've got a lockdown, but they've left our universities and our schools open. And so people are going into those schools and universities and bringing the virus back into our overcrowded, multi-generational families that we've got in this community. And we have a test and trace system that's managed nationally that doesn't work or is only just beginning to work properly. So I think we've got lots of things that are happening that are good, but very often they're introduced too late and with too little organisation to be as effective as they could be.
Boshura, if I can come to you, you obviously worked right through the first wave of coronavirus, and you obviously have families, you have to protect yourself. And we know at the beginning of March or middle of March, there was a lot of outcry about not having enough PPEs, protections, masks, gloves, aprons, so on and so forth. How did you manage? How did you cope? Or how did your colleagues cope? Because you work in a COVID ward and you saw people dying, you saw people recovering, and how there must be psychological impact on people like yourself and your colleagues who's working day in, day out.
I mean, when the pandemic first came in, it was really scary. It seemed like a silent war that we were fighting. Initially, it was scary because I have small children. I have my husband, I've got extended family. Luckily, I don't live with in-laws. Well, they've passed away anyway. It's just me and my immediate family. But I did have that scare factor within me, like, oh my God, am I going to bring this home? You know, what will happen to my family? I couldn't see my immediate family. It was complete lockdown. And you mentioned the psychological impact. We all went to work. Initially, it was scary, but as the weeks went in, we all we went in and we did our job to the best of our ability to help the patients that came in, and the emotion and the psychological effect, that I think it will stay with us for the rest of our lives, because that's how it's impacted us, because we saw so many. We saw deaths. People were on their own. We had to be their family. It was a really tough time for families as well as us, as well as the patients as well. Having said that, we did have a lot of recoveries as well. So I want to highlight this. It wasn't although it did cause death, we had lots of good news stories that we celebrated as well.
No, yes, I saw one of the story that one of the patient, I think after significant number of days being in ICU, he remarkably recovered.
Yeah, so Dilwa Hussein, I organised for Channel West to come and interview him. He had a 6-month stay in hospital. He was in intensive care. And he was one of our first patients that came in with COVID, and we thought he was going to die. So he had a prolonged stay in ICU, and obviously the rehab after that, there was a good 3-4 month stay post ICU, and it was amazing to see him recover from COVID and to see him go home after such a long time. It was brilliant.
Tazmina, I just want to ask you, because I have named this show Our Heroes, and I sincerely believe that you guys are the heroes and the backbone of the NHS and the society, because if it wasn't for people like yourself going in to hospital, risking your lives, because some of us are very fortunate. We can work from home. We don't have to go out so often. But, people like you don't have any choice. You have to go in because there's hundreds and thousands of lives are dependent on people like yourself. And I know the hospital you're working in at the moment is filling up. How are you finding it? How are your families? Because, you and Boshura, both of you have very young children at home. There must be some kind of worry in children. My mom is going into hospital when the whole country is in lockdown. There must be some kind of worry. What could happen to my mom? What could happen to your families? Things like that.
Thank you, Oliur. Yeah, it's very true. It was very traumatizing in the initial stage when the pandemic just started. As you know, that being a discharge coordinator, I had never experienced anything like this within my career within NHS. And when the pandemic just started and immediately we were seeing deaths after deaths, and every day going to work was so traumatizing. My 3-year-old son used to just beg me, "Mommy, don't go to work today. We want you to stay at home." And it was very heartbreaking in terms like going to the hospital and just finishing the shift, coming back home to the family, just thinking, "Oh my God, am I bringing it home? I've got young children in the house. I've got a husband who has got vulnerable health condition as well, myself." And together, at point, it was very, very traumatizing. But gradually now in the second lockdown, we have come used to it. We are more organized, and we're just we know how to deal with it, which we didn't know in the first pandemic when it just started. First lockdown was it was just like a throw on your face. You don't know what you're expecting, what you are coming for. When you're going for a shift, you just don't know what you're going to be expecting there. It was like in fraction of seconds, you're losing lives. And it was really traumatizing. Being a discharge coordinator in a ward, I would plan discharge for my patients' safety at home. I still remember I planned discharge for my patients, but I've just lost that patient that day, which was very hard, very, very heartbreaking, very heartbreaking.
Kambiz,
Can I just jump in there, Ollie? Because
sure.
I think we've also lost colleagues. I mean, at my health centre, there was Dave Last, who was our caretaker, and he spent a week at home on his own before he was admitted to hospital and dying. And then round the corner from where I lived, there was a West London nurse called Donald Suelto, who died alone at home. And there was Yusuf Ali, who was a driver for Hamlets Council, taking children to special schools, and he died alone in his flat. And we had a Newham GP, Dr. Yusuf Patel, who was the 5th GP to die of COVID in the Wood Grange practice there. And he started his practice in 1989 from scratch and built it up to 15,000 patients and trained lots of our practice nurses. And these people are sorely missed, and it causes the rest of us trauma. And at Homerton Hospital, there was the Dr. Chowdhury, who appealed for the appropriate PPE and wrote to Matt Hancock saying that there wasn't enough personal protective equipment in the hospital, and he died. So I think we all know people like that, and I think that is some of the things that we'll carry with us. As you said, for as long as we live, we'll remember those people.
No, absolutely, Kambiz, and I tried to look at the figures, and I think I could find the figure from August, and it was more than 620 NHS and social care workers have lost their lives trying to protect others, and I think absolutely we pay tribute to them and to their families for the sacrifices they have made for this country and for people of this country. But I also want to touch that you have been GP for very, very long time, and you know many doctors, many nurses, and you work in the community, you're active in the community at Kambiz. And how do you think, from your perspective, the community is managing in regards to COVID?
Well, I think it's very hard, because when people haven't got a lot of money, particularly if they're self-employed or on contracts or on these sort of temporary insecure contracts, and you are told that you have to self-isolate, and that's going to cost you a lot of your income, all of this stuff, I think, makes it very hard for people to cope. So I think the community is suffering, although I think people do understand the need that we all have, or the part that we all have to play, and that we have to wear masks when we go into enclosed spaces. And, at the beginning, very few people that you saw were doing those sorts of things. But I think increasingly you are beginning to see, the community pulling together and taking the necessary steps to get this pandemic under control.
Boshura, you obviously, like I said, you worked during the first wave. Now we are going through the second wave of COVID, and when individuals get admitted to hospital, especially from South Asian communities, Bangladeshi community, because obviously where you work is the heart of Bangladeshi community, and when somebody goes in, especially an elderly person, they lack English, their communication skill is not so great. They are frightened that they might not come out of the hospital. They can't see their family members, because normally if you're ill and if you see your loved ones, that does help with your mental ability to cope. But obviously you're not seeing that. You're seeing in front of your eyes, people are dying, and you think, oh my God, is it my turn next? And that's the kind of feeling people can quite easily get. But what kind of support do people get, patients, or what kind of support is there for the families?
I mean, generally, we have a no visitor policy at the hospital now, since April anyway. But we have, especially it's within our community, when the older generation do come in, we have, like, I'm a Bengali speaking nurse, and I always advocate for my patients, because I feel like if I'm in that position, I would, or if I had a loved one in hospital, I want someone to be there to comfort them as well. So advocacy is always there. There's so many Bengali speaking nurses, healthcare assistants that work within the hospitals. Not only that, we have iPads and phones available that we arrange Zoom calls for patients as well as with their families anyway. And most patients, they have their own mobile devices anyway. We continuously update family members with progress, or if they're in ward round, we call the families. But for speaking for myself, generally, I always advocate for all the, because it is scary, especially them being on their own. They're anxious, their families are anxious, we're anxious as well, because we don't know what the family's going through. So I always make it a point to advocate for my patients and to ensure that they understand fully what's going on, COVID or non-COVID, whichever it is. I'm there to help, and my whole team knows that. And I extend my help out to other wards as well when needed. So it's all there, and it is scary, I'm not going to lie, because I wouldn't want my mum or dad to go to hospital knowing that they'll be on their own, and their English is very limited. But nurses, doctors, they're all very reassuring. We have language line as well, where when there's no advocacy available within the wards, they can contact them, or even family members. I mean, majority of the households have English speaking members, children or nephews, nieces, whoever it is. So it's reassuring to know all that's in place.
But can I ask, obviously sometimes when the patients are taken into intensive care or ICU or put on life support machines and all of those kind of, because of they have severe difficulty breathing, because sometimes that could be the last time they speak to any of their family members, and that must be very traumatized, not only for of course for the families, for the patient, but also for people like you and your colleagues working there, because knowing full well that individual might not make it through.
Yeah, it is tough. I mean, initially during talking about COVID in particular, during the first pandemic, obviously it's like Tazmina said, it was all new to us. So we had palliative patients that were reaching end of life, literally. It was imminent. It was so difficult because we didn't know, are they allowed to have a loved one with them? We had some patients many that died on their own, but we provided that comfort for them when we knew that they were reaching end of life. And moments like that, they do stay with you, and we do our best. We did, and we still do our best to comfort those patients and their families, ensuring that they're comfortable, and especially within our obviously majority with the Muslim patients anyway. It's important that we have people reciting over them. So I made it a point for myself to learn or explore that aspect of it, to see what needs to be done towards end of life. And I always kept close contact with that imam as well. He was amazing throughout the pandemic, and he still is. So he was around all the time. He was really, really good. So having the imam there helped a lot of people, and comforted a lot of patients plus their families as well.
No, thanks for that, Boshura. I think it's really important. People with faith, whichever faith they believe in, is really, really important to them. And sometimes the faith keep them going, keep them fighting the battle. Tazmina, I want to ask you, I know many hospitals, and I saw the Kent Hospital treating 10 times more COVID patients than previously. Many hospitals are quite rapidly filling up. The beds are being taken, as we get into closer to more winter months, it's going to get 10 times worse. How are you guys going to cope?
Well, we are already in that situation at the moment, because obviously like flu season has already started, and like currently I'm in a COVID ward, and like even if I say I had like discharge plans for my patients over the weekend, I went to my shift this morning and I found out they are not there, which is really sad. And like it is just something we are just trying to, like, we had planned for, just like we thought we can manage with 2 COVID ward, but it looks like the whole floor is a COVID ward at the moment. So they are just expanding gradually, and obviously the pressure is quite high. But as I said, I mean, like on the first phase, we were not prepared at all. At all, we were not prepared. But we are trying to be strong mentally. Like, as I, like, you know, when I joined this job, I was not prepared to see so many deaths, which we have experienced in past few months. Like that, in past few months, it was like so traumatizing. But now we are just more mentally stable. We are going for counseling, staffing wise, and all the team member that we work in a team, we are trying to like participate in like counseling through the occupational health, getting mental supports to make ourselves strong. And as Sister Boshura was mentioning, I mean, like there are events, or like there are situations where patients are just left there by themselves, and it's just our hand that we hold at that very last moment. And honestly, Olipai, the thing is, like, this is some kind of experience that if you don't stand there, you will never realize, you will never feel, unless you face it yourself, unless you face it with your family. This is kind of experience that people will never, like, you might see in the tabloids, you might see in the media, we are watching, we are reading, but until you're standing there on the ground, on their shoes, you will never realize how difficult the situations are. So we are just trying with hopes and like with the capacity just to trying to accommodate. And as you know, that East London is a very densely populated area. All the hospitals are struggling, and we are in almost every hospitals are almost in the same sort of situations. But we are just, we kept our hopes going, and we just feel like that, yes, we can do it. We have to do it.
Can I add in that?
Yeah,
Because,
sure, come in.
you know, your question was about how well we are coping and how full the wards are getting. Now, if you look at the number of beds and how unprepared the government left us before we entered this COVID epidemic, in Britain, there are about 3 hospital beds per 1,000 population. And you compare that to Germany, there are 8. And France, there are 6. So really, as we went into this pandemic, there was no spare capacity, which is why people are talking about why cancer patients and heart patients now at the moment can't get their care because the beds are filling up with COVID. So the nurses and the doctors are doing all they can, but you can't make 3 beds per 1,000 population do the same work as 6 beds or 8 beds in France and Germany.
Kambiz, you know, you mentioned about cancer patients. You know, I know from the research, almost 3 million cancer patients' appointments was cancelled because of the coronavirus, because the hospital wasn't prepared. And many doctors, many NHS trust bosses saying, look, if we don't prepare ourselves now, if we don't get enough resources, we could be in similar position come December, January, you know, when the weather will be much colder. But I want to ask you, why do you think we're doing so badly compared to some of the other countries in Western Europe?
Well, because we have had, you know, 10 to 15 years of cuts in the health service. You know, you can see that at all levels. Pay is low, you know, hospital beds are low, capacity in general practice is really stretched. So at every level, you know, before we entered into this COVID pandemic, people were at the very limit of what could be done with the resources. And if it wasn't for the fact that the NHS makes very good use of its resources compared to private systems in, say, in America, we would be in a far worse situation. So the NHS does a lot for every pound that it gets, but it really doesn't get enough pounds from the government. And that's the fact of it.
And I want to ask you another question, and apologies to my 2 guests. I'm taking a little bit more time with Kambiz because I think it's really crucial we get this message out. You know, we saw during first pandemic, first wave, Kambiz, or in March and June, that, you know, we came out every Thursday at 8 o'clock. We clapped for our heroes, you know, our doctors and our nurses, and we praised them. We put stickers, you know. My daughter made it, because her mom is a doctor, so my daughter made a sign sticking on the windows, and I've seen it up and down the country. But to be honest with you, I want to, and I know you'll give me a very
Yeah.
honest opinion. Do you really think that this government values the doctors and nurses and the contribution and sacrifices they make? Because, for example, if somebody died in the line of duty, they get £60,000. That's it. You know, far as I know, there hasn't been no, given I'm from a trade union background, there is no pay rise really for NHS doctors and nurses. So clapping for them doesn't pay their mortgage or their bills, does it, Kambiz?
Well, what they've done is they've put the millions of pounds into consultancies. 252 million goes to companies that provide PPE that doesn't work to the NHS because they happen to be mates of Matt Hancock. Dido Harding gets brought in as head of test and trace, with these multi-million pound contacts to provide a service that doesn't work when our GP networks and local public health departments in the town hall could do the job far better. And then they say there isn't enough money to pay our doctors and our nurses. And then you get headlines from the Daily Mail saying that, why should dietitians get any money? Why should physios get any money? Because they weren't on the intensive care unit. And I think that contrast between the large amounts of money that they pay out to these private firms, and the lack of respect that they show the health workers on the front line is is a disgusting contrast.
Well, they spent £12 billion on track and trace. That's something that didn't work. The Excel sheet went crap and it didn't work.
Well,
it was just all over the place.
to try and make this, so the track and trace, it's doing a fairly good job now at contacting people who are test positive. So, for example, in Tower Hamlets, about 80% of people who have a positive blood test because they go and ring 111 and get a blood test, they're being contacted. But when it comes to contacting their contacts, it's doing very, very poorly. So only about 50% of the contacts of someone who has COVID is it actually reaching. And I'm certain that our community health services on the ground would be able to knock on doors and track down the 90% of the contacts of the people who have got COVID. And the national service isn't doing that because it's not culturally sensitive. If people don't pick up the phone, don't answer their phone, or don't have English as their first language, we need, you talked about other contributors to your program who talked about advocacy in areas like this particularly. We need people who understand the community to make track and trace and support really work.
Thanks, Kambiz. Boshura, let me ask you, and I want you to kind of a little bit explain for our viewers. So if somebody goes in for, say, non-COVID related health issue, do they sit in separate place or separate location? And reason I'm asking that because we saw from the first wave, many people went into hospital for non-COVID related health issues, but while they was in hospital, they catch COVID and some sadly subsequently passed away. So what kind of structure is in place, just to give a little bit of reassurance to our viewers?
It's all separate. So when you do go to A&E, you have COVID related queries go to one end, and then you have non-COVID related patients on another side. Again, with the wards, when they are cohorted, if it's COVID, they'd get tested. They'll be inside rooms in a query ward, and if they're positive, then they're moved to a COVID ward, and if not, then they're moved to the allocated ward. Again, if it's so, everyone that comes into hospital is tested for COVID, and depending on the results. So even if it is non-related to COVID, but they test positive for COVID, they'll be taken to a COVID ward. So I think everyone should rest assured that it is all kind of separate, but everyone is tested.
Tazmina, I want to So you and Boshura and also Kambiz touched on how difficult it is for the colleagues working in frontline in NHS, seeing death on daily basis. Some people are relatively new doctors, new nurses. Some are far more experienced.
Mhm.
From obviously individual trust may work differently because and just for our viewers, the trust is work differently because different hospital is managed by different trust.
Mhm.
um, what kind of support are there for doctors and nurses, because we know many doctors and nurses had to leave home during March lockdown. They didn't see their families and children for weeks and months in some instances. So what kind of support are there from individual trust for the doctors and nurses and other staff working in hospitals?
Well, currently, obviously, it's more open now because people are more used to the COVID thing and they have understood that, like, if you have symptoms, you self isolate, or if you're working in a COVID ward, you self isolate yourself. If you have vulnerable people staying with you, or family member or extended family member, you just self isolate. So initially, in current trust where I'm working, we were offered accommodation wise, like staff accommodation, so staffs could come and stay in there while they were working in the COVID units and COVID wards. And I am not 100% sure for the current situation, but I still remember few of my colleagues were allocated to like the staff accommodation to stay there, so at least like they don't have to go back to their own home. Like they ended up staying there for weeks and weeks due to their job purpose, because they were absolutely working in the ITU or like sort of COVID area where it was very vulnerable. So, I mean, like, apart from that, we do get like supports from the occupational health for different counseling, like different sort of like mentors are there to console, because obviously, like, as I said before, that no one of us was prepared to see the face of death in such a small span of time. And this was like an absolute like a situation where like we were never been trained to see so many death in one go. I mean, like when we got into this job as a doctor, as a nurse, as a medical like supporting staff, none of us were trained to see so many death in one go. We were not prepared, and this was absolutely a traumatizing experience for everybody working in the healthcare industry. I mean, like from the consultants to the porters, everyone, the front line, we were never experiencing anything like this. And all of a sudden, when this thing came, I mean, like it was a bit of challenge and shock for the trusts as well. And eventually, I mean, like as the time went by, we got used to, I mean, like at one point in the initial stage, people were scared to come to A&E with simple matters which
Yes.
were not related to COVID. But now we have zoning system within the hospital premises, and for the staffing, even the staffs are zoned up, so they know that who is working in the COVID ward. They are in their zone. They don't have to wear uniform. They can wear the scrub, so they don't carry it home with them. So these are the like the facilities that is been offered through different trust in different manner for the staff.
And can I ask you more of a very direct question?
Mhm.
Obviously, during first lockdown or first wave, we saw there was huge struggle about PPE, appropriate equipments, and as Kambiz mentioned, a few names, and one of the name was Dr. Chowdhury, who wrote to Matt Hancock, wrote to Prime Minister, pleading for him and his colleagues, to be provided with necessary equipments for them to do a job. And I often say, it's the employer's job to provide the equipments for me to do. It's not for me to stress about the equipments so that I can do the job. But do you guys now have enough equipments to protect yourself and your colleagues?
I wouldn't say 100%. I wouldn't say that, because I am in a COVID ward, and I wouldn't say it's 100%, but I would say it's better than before. At least, like, it is better than before.
There is some improvement. Kambiz, you know, in terms of mental health, we talked about, and I personally done a show. Many people talk about mental health of general public and how they coping, staying home, not able to go out, all of those kind of stuff, and necessary support or investment from the government, whatever that is being made. But is there any specific organization, establishment where doctors and nurses can go, apart from occupational health, which is a kind of a standard one, that they actually can go and talk about the griefs or issues? Because sometimes, like you said, people who have lost, who's been you worked with, I know people who have worked with over the years, no longer here. And sometimes it kind of take you back a bit and you think, oh my God, wow, what do I do? Is there something like that?
Well, as I say, I've retired from clinical practice a few years ago, but I'm still part of the kind of GP network in Tower Hamlets. And at a group level, we have a very, very active WhatsApp group that connects all the practices in Tower Hamlets with all the doctors and practice nurses and receptionists. And that is just simply buzzing. And, practices are giving each other advice, where shall I send this person who's got this condition at this moment? As the sister just said, is this particular unit closed or is it open, and can we send them there? So people are giving themselves a lot of support. And I think those sorts of things are quite common throughout the community. So I've noticed that, during the start of the first wave, we even had lots of WhatsApp groups in our streets locally around where we lived. And I think those sorts of self-help things are very important, but that doesn't take away from the health authorities and the hospital trusts the responsibility to provide proper psychological and emotional support for people who are severely traumatized, because that goes beyond the skills of self-help and the sorts of support that we provide our colleagues.
We are getting loads of comments, mainly praising you guys for the work you do, and quite rightly so. Boshura, I want to ask you, given you are from Bangladeshi background, you live predominantly in Bangladeshi community, but I often see, people are from the South Asian communities are still quite reluctant to wear their mask, maintain social distancing. You go to shops and, those measures are not there. And is it, from your experience, is it lack of understanding, or is it just people just think, oh, there is God who will protect us and nothing will happen to us?
Yeah, so I think you have those who think COVID is a conspiracy theory, and then you have the one, it bottles down to lack of education. I mean, from the pandemic initially, I think we are doing a lot better, but because we had the lockdown and then the numbers did go down, everyone's kind of, not everyone, but people have relaxed a bit. But I think it's important to stress that this isn't over. Flu season's started, like Tazmina said. We don't know what will happen in the next couple of months. So it is so important that we continue to wear masks if we are going out, go out if we need to, and maintain the social distancing, because schools are open. You don't know if your child's bringing in COVID. You're going to work. You can easily bring it in, and if you go to your neighbour's house, for example, you can potentially infect that person. And we have a lot of elderly neighbours, and it's important that we look after them as well. Like this evening, one of my aunties from next door, she said to me, Boshura, why don't you come to my house? I said, no, Sassi, I can't. And she more or less had to go at me. I said, no, I can't. I have to protect you more than anything. And I recently had COVID 3 weeks ago, so I for sure know that I have to. We all have to kind of go by the rules. Washing hands, keeping wearing the mask and maintaining social distancing is so important, because you don't know who's going to get it at what time and who you will infect.
So it's obviously go on, Kambiz. Sorry, come in.
And I think the government came late to the idea that was going around in the scientific literature that COVID is really an airborne condition. And that therefore the time where we are at greatest risk is when we're indoors with poor ventilation and there are lots of people in the same room. And that's why I'm anxious about schools and universities, because that's where people are crowded together. And the thing about children is, although they are not very ill, they can bring infection home, as you've also said, and bring that back into the house where your elderly grandmother is living. And it makes all the other things that having the flu injection, for elderly people and for the children so important, because we don't want to have to deal with people who are already weakened by having ordinary flu, then catching COVID on top of that. So there are lots of things that we can do. We can wear masks indoors, and we should avoid crowded places, and we should have lots of ventilation.
I was going to ask you that specific question, Kambiz, because we know many parents are extremely worried about their children going to, whether it be primary school or secondary school. We saw huge numbers of cases in universities and where the students had to self-isolate in their hundreds, and government is still reluctant to close down the school. I know that some of the NHS bosses is calling for tougher lockdown and school closure, keeping secondary schools, keeping colleges and universities where younger generation are kind of mixing.
Well, of course, it is hard, because if you keep kids away from school, they suffer psychologically as well. And there's no doubt about that. If I look at my grandchildren, they really want to go to school. But if we're going to do this effectively, if we're going to bring the pandemic to a halt, then let's look at the reasons why I think, and it's a personal opinion, the government has kept the schools open. They've kept the schools open because they don't want the parents of the school children to have to take time off work. They want to keep the economy going. So they're putting, in a way, the profits of the businesses before the lives of their population. Not to the same extent as Trump is doing in America, but to a degree. And therefore it means we'll be constantly going through one lockdown after the other, unless we get everything right first time. And I think getting everything, sorry, yeah, go on.
Yeah, so the other issue I wanted to touch, Kambiz, is obviously we're talking about doctors, nurses, and NHS stuff, but also the other group is the teachers, who actually putting that self in there. And I know some of the teachers who have lost their lives or lost loved ones as a result of it, because they could potentially take.
My daughter and her husband are both teachers. They both got COVID quite badly, but fortunately have both made full recoveries. But the head of department in my daughter's husband's school, he died. He was black from Africa. And we know, of course, we haven't discussed this, but everybody knows that black and ethnic minority people are 2 or 3 times more likely to die from COVID than the majority population in Britain. And I don't think that's to do with people's race. I think it's to do with the structural racism in society that pushes black and ethnic minority people into the worst jobs and into the worst housing and the overcrowded conditions and so on. So I think there is a lot that's structurally wrong with society that has put, black and ethnic minority people into the front line in a way that should never have happened.
Thanks, Kambiz. Tanzina, I want to ask you, obviously, there is hope, or at least we believe there is a hope at the end of all of this, because so many people are being infected by this dangerous disease every single day. Between 300 to 500 people losing their lives. People are every day battling, to keep breathing, to keep going for another day, another hour, another week. Um, do you see that we could eventually kind of get this completely down? Can that be possible, or is this something that we, as a population, might have to get used to it and kind of live with it?
Well, the thing is, currently, I mean, like, say for example, when I was discharging like patient with COVID before, I was very much scared to send a positive patient within the community, because obviously the community itself wasn't that much prepared to accept a positive patient coming from the hospital. But in current situation, I am happy to discharge a COVID positive patient who doesn't have any severe symptoms, who needs to be into an acute bed, who can recover, self heal in their own environment. And that is something like a lifestyle sort of thing that we hope for the best. And we just think that, yes, it is like, like we are more used to it now, to accept the reality and live with it, in terms like things will get better. Vaccine is very close. I mean, like, we are expecting the vaccine to come very soon, get introduced within our community, and the people can have the usage of it and make the most of it. And on terms like, as was mentioning before, that we are more like into like, in terms, yes, we are more used to it now. And also hope is always there. We are just thinking that, yes, it is going to get better once the vaccine comes in, awareness is more within the people and the community, and hopefully at some point this virus is going to disappear and make life more easier.
Kambiz, this vaccine that now everybody's kind of talking about, what is your take on it? And do you really think that's going to help the community?
The vaccine is going to be very important. And the really good news is that the preliminary trials on the first two vaccines do show that it was much more effective than people were expecting. People were expecting 50 to 60%, effectiveness, and the figures coming in, as people have no doubt read in the newspapers and seen on the news, are around the 90%. However, I don't think we should underestimate the problems that will happen. First of all, the vaccine that's been most talked about has to be stored at sort of minus 60, minus 70 degrees at very cold temperatures. GP surgeries are not set up with fridges that will operate at that temperature. So a cold chain has to be brought in that will allow this vaccine to be delivered at minus 60, minus 70 degrees centigrade and maintained at that. And if we look at the success or lack of success of, the track and trace and all that sort of thing, we can wonder whether the government will be able to get that infrastructure in place. And then I think that, this is a virus that has jumped from animals to human beings. And, we've read in, is it Finland or Denmark, how it's Denmark, I think that it's jumped back into the minks that people make their mink coats from. And so I think that I was listening to a symposium at the Royal Society of Medicine on Thursday that was saying this virus, will come back in different forms, for a number of years. We're not going to get rid of it, but it will become, much less of a problem, and we will get back to normal. But I think what the normal will be in the future won't be the same as what it was up until now.
Boshura, obviously, as we talked about, there is vaccine. Well, hopefully it's in the process and people will get it. But obviously not everybody is going to be able to get it in one go. I don't think that's going to happen. Because people who's making the vaccines, they already saying they don't have enough supply as the demand, and they're fully aware of that. But what would you say to our elderly people from the BME communities? Like you said, this auntie inviting you to her house, because a lot of them, they do it from genuine love, and because that's they are genuinely caring individual. But obviously, many of them may not realize that they're putting themselves more than anybody else at risk, and potentially could cost them their lives.
I mean, it's important for all of us. Everyone, obviously, the generations change. There's English-speaking family members in the houses. It's important for us to relay that message to our elders and explain the importance of social distancing and not having people come to the house who could potentially have the virus. I mean, I'm just going to touch on hospital admissions as well. We do have people that are really anxious, especially family members, when an elderly member of family member goes into hospital. We all speak English. There's always someone speaking English in the household. You have to ask the right questions. If you don't know something, you ask. No one's going to refuse not to answer any questions. If you don't ask, you won't know. And, potentially you could be missing out on vital information. So that's just one thing I want to encourage as well. I know it's an anxious time for all of us with our loved ones going into hospital, but we have systems in place. My ward is brilliant. We look after all our patients, especially knowing that family members can't come in. I always go that extra mile to help for people from our community as well, because I know we have that language barrier. To ensure that they're comfortable, whether it be just for treatment, medicinal purposes, or if they're reaching end of life. But I think it's really important. If we could get more advocates, like Doctor mentioned, in the community too, with the track and trace, to re-emphasize that message to our elderly community, it would be brilliant. It just needs to be reinforced over and over again. But I think with COVID, it will stay with us for a while, and hopefully it will get less potent. But it's something that we need to get used to, and just adhere to the rules and regulations that are in place at the moment, and hopefully we can all, together fight it.
But there is the international perspective as well, because the rich countries of the world, like we're in, that are buying up all the stocks of vaccine, and a vaccine is not effective in a country that can't afford to buy it. And we know that this is an international, pandemic. So if we leave countries like Bangladesh and African countries on their own, then the virus will come back and hit us here, just like it did the first time. So this business of, rich American companies producing vaccine at high cost, and then, the richer countries of the world scrabbling to get first in the queue to buy up all the stocks, is not going to be something that will rid the world of COVID. And if we don't rid the world of COVID, then it's going to come back to this country probably sooner rather than later.
Yeah.
Tazmina, I want to ask you, because obviously now we are forcing, or kind of trying our best to get people to wear masks, and I see that it is slowly but surely improving. But at the beginning, the message was that we don't need to wear masks. There is no evidence due from anything. When the World Health Organization was calling for people to wear masks, where almost every country in Europe was wearing masks, but the UK was far behind because they didn't want to tell people to wear masks. Was it because at that time NHS was already struggling themselves? There was not enough masks in the markets. Was it that, or was there genuine some kind of evidence that you saw that mask didn't really work, then now it works now all of a sudden?
It's a very tricky question, because to be honest with you, as our doctor friend said in the beginning, that everything was delayed by NHS procedure, even the lockdown procedure, it delayed. which we are paying the price for it. The mask thing as well. I mean, like when the pandemic just started, nobody cared about the masks. Masks were there. It's not that surgical masks were available. Maybe the PPE, proper PPE wasn't there, but surgical masks were there, but it wasn't a mandatory the way it is currently at the moment. So, I mean, like, I think personally, it is not that we didn't have enough masks. We did have masks, but it was not implemented in a proper way, because maybe the system or the policy, like, they didn't take it as serious as the other country has taken in within the Europe, or like within the other like First Nation countries. They took it very serious, like Germany, Italy, some other countries. They took it the measure quite like strictly, and that's why probably their ratio is lower than what we have currently, and we are on the maximum death rate within the whole Europe. But obviously, I mean, like, I wouldn't say like surgical masks was available everywhere, maybe not the proper like K95, all the like the FP3 masks, probably those masks were not available, or the proper PPE gears were not available, but surgical masks were there, and nobody bothered about it at that stage. So, I mean, like, this is something like now people do understand, or even NHS or the government policy, they do realize that this is something that can protect people. Let's put that in implementation, and they just brought it up, and we're just living with it.
Kambiz, we are almost end of our show, and I just want you to touch on a couple of things before we conclude. When it comes to masks, what is the actual procedure? Because a lot of people are concerned that, you know, wearing the same mask over and over, people putting in their pockets, in their side, and then putting on their face again. It could carry a bacteria, you know, it could make things worse. What would you... What would be your explanation?
You know, our nursing colleagues have talked about, you know, if you're a health worker and you're in a COVID ward, the mask is there to protect you, and you need a properly fitting mask that have these sort of initials in front of them, you know, FP, whatever. If you're going shopping, the mask is predominantly there to protect other people. But if everybody wears them, then you're protecting yourself. And what I think has come to people's understanding late is that COVID is not simply spread by droplets and by touch, but it's also spread by an aerosol of very, very fine particles. And masks, even a cloth mask, is effective at stopping the spread to a fair degree. So you can be in a room with other people for longer with a mask without catching it, but you still need proper ventilation in that room. You know, so schools should have their windows open. They should have, you know, air conditioning that takes the air outside of the room, because, you know, and all these things work together. So it's not that if you just have a mask, you're safe, or if you just have good ventilation, you're safe. All of these things add a little bit, one on top of the other, and the 2-meter rule and the washing your hands and so on. But we shouldn't fix on any one of them. We need to be doing all of them with proper contact tracing and treating and the immunization program, and all of those things put together will give us the best chance of getting on top of COVID.
Thank you, Kambiz, for that. Boshura, you got 30 seconds. Any message you want to give to our viewers?
Oh my God, you put me on the spot. Follow guidelines, like doctor said, ventilation, hand hygiene, face masks, social distancing. Just if you do all this, we will all reduce the risk of catching or spreading COVID. Thank you.
Tazmina?
Same here with Boshura, I would agree. Stay safe, follow the guidelines, and enjoy your life. Don't be disappointed, don't be disheartened, don't be scared. Just follow the guidelines. It is there. Follow the social distancing, wear the mask, wash your hands, and be safe.
Dr. Kambiz, Boshura, Tazmina, thank you so much for joining me this evening. Thank you so much for everything you guys do. You guys are true heroes of this country, and the contribution you continue to make in society. So thank you for your time. Thank you for your contribution.
And thank you for leading such a good discussion.
No problem. Thank you so
Thank you
much.
for having us. Thank you.
Thank you so much for joining me and my team this evening. I hope you found this discussion useful. As you heard from our nurses and doctors and other NHS staff who are working, clapping for them does not pay their bills and mortgages. They're risking their lives every single day so that they can protect people like you and me. So it is important that we support our doctors. Often we see in press and in media the doctors or nurses get attacked on the street. That shouldn't happen, and we should not be tolerating such attack or abuse towards anybody, let alone the people we call our heroes. So thank you so much. Stay safe, wash your hands, maintain social distancing, wear your mask if you're going out. Don't travel unnecessary. Remember, it's only essential travel. Until next time, stay safe.